With you talking like that.
Okay, I'm not talking. Stop talking. Not talking now.
90.1 KPFT, Houston.
I'm Alec Baldwin. Like any parent, I'm concerned about children's health. Many kids don't eat as they should and are at risk for long-term health problems like diabetes and heart disease. But here's good news. Fruits, vegetables, whole grains, and other low-fat vegetarian foods can protect our kids and keep the rest of the family healthy, too. For a free booklet, call the Physicians Committee for Responsible Medicine at 1-877-685-KIDS or visit www.kidsgethealthy.org.
Stay tuned to Vegan World Radio. On tonight's show, we will be talking to two health experts and participants in the upcoming town hall meeting being held this Saturday, October 17, 2009, at the Kingdom Builder Center. The subject of the town hall meeting will be the declining state of health in the United States, and will feature world-renowned medical experts from all over the United States who will gather in our city to share their knowledge and wisdom about how to preserve our health and avoid, and when possible, reverse chronic debilitating ailments. The town hall meeting is being co-sponsored by JAM Institute and HCA Wellness. In our studio tonight, I'll be joined by Dr. Baxter Montgomery, a Houston cardiologist who is organizing the event. And later on, we will have via telephone from the East Coast, Dr. Caldwell Esselstyn, who will be one of the participants in the town hall meeting, author of the book Prevent and Reverse Heart Disease. As we answer your medical questions on plant-based eating, all this and more coming up next on Vegan World Radio. Good evening and welcome to the Vegan World Radio Show. We come to you every Wednesday night from 10 to 11 p.m. here on Pacifica's KPFT, 90.1 in Houston, 89.5 in Galveston, and online streaming at kpft.org. Please find Vegan World Radio on Twitter, Facebook, and YouTube. For the details for tonight's show, please visit our website, veganworldradio.org. My name is Dr. Anteneh Roba. I've been a practicing physician in the Houston area since 1995, and I'm a co-founder of the International Fund for Africa, an organization dedicated to saving human and animal life in Africa and abroad. I will be guest hosting this evening's special program. The music you are just listening, we will be taking your phone calls tonight, so please be ready to phone in your questions to us at 713-526-KPFT. Our guest for this evening is Dr. Baxter Montgomery of the Houston Cardiac Association, who has organized this weekend's town hall meeting entitled The Declining State of Health in the United States. He has an astonishing lineup of medical authorities in the field of plant-based living, and we welcome them to the Houston area. Dr. Montgomery, welcome back to Vegan World Radio.
Thank you for having me. Good evening.
Yeah, you've done an awesome job getting all these really world-renowned experts to our city to impart their knowledge and wisdom on plant-based diets and the benefits of it. Tell us about this program coming up.
Yeah, thank you. We were very blessed to have the opportunity to bring these speakers to Houston. The idea was conceived in the context of a practice at the Houston Cardiac Association, and as we work to try to change the lifestyles of the patients and creating a wellness program, the more I looked out into the professional community, looking at the patients, I realized there was a communication or education gap, if you will, in terms of what is optimal for health. When you look at the scientific literature, there are a number of books that are pretty clear in documenting the benefits of plant-based nutrition. However, when you look in the professional community, there seems to be a lack of knowledge or lack of understanding of this information. So I felt that it'd be important to try to convene a group of experts to bring forth this information and to present it directly to the community, directly to the general public, and create the beginning of what I hope to be an annual platform of dialogue between the experts and the general community and policymakers.
Okay, actually, that was my second question. What's your goal, your objective in the broader term with this?
The broader term is to create a program that on an annual basis that can carry out perhaps two general objectives. One would be to create a platform of dialogue between experts who can communicate with the general public the importance of optimal nutrition, the importance of optimal lifestyle change that can help them impact their lives. One thing I realize in my practice is that once patients are engaged, once they're informed, then they are able to take this information and improve their lifestyles. I've seen it happen in individuals as young in their 20s or 30s, even individuals in their 80s who have, chronic illnesses can make changes in their life. So that's one. Two, by convening these experts on a regular basis, we can actually perhaps set some standards that can affect some of the policies in the local community, perhaps with school lunch programs and the like, and perhaps even create some national dialogue. So this could perhaps be a model for either a series of conferences that occur over the country or a large conference that is nationwide. So we have big dreams.
Now, have you gotten any support from the local community, medical community, from other physicians?
Yes, we have. One of our guest speakers will be on the panel will be Dr. Lance Gould, who's been involved in heart disease reversal for many years. There are a number of other physicians who have been supportive in other ways, but I think there's much more room for more support, so we'll be working on this over the years as we do this.
Okay, wonderful. Well, in a few minutes, we will start taking phone calls, but first we are joined on the program by one of the distinguished doctors who will be speaking on this issue this Saturday. Would like to welcome to the program Dr. Esselstyn. Is he not available? Okay. Let's talk about what kind of program are you going to be presenting? What are the issues that you'll be discussing today? Saturday.
Saturday. What we have laid out, the program is designed such that there's a morning session where we, for the most part, state the issues. We'll have broad discussions on some of the major chronic illnesses, heart disease, diabetes, cancer, particularly type 2 diabetes and obesity and cancer. Then at the end of this section, we'll have about a 60 to 75 minute session where it's an open forum. The speakers will sit on a panel, and then we will pass the microphone around and open the floor, take questions from the floor. It'll be moderated in part by myself, and Carolyn Campbell, formerly of Channel 11, will help co-moderate. So it'll be an open forum session. The noon session is a 90-minute period where there's a lunch period. At the break of the first session, individuals will be able to go and get a healthy vegan lunch that'll be provided. And then there are several breakout sessions. There's a lunch session with Dick Gregory.
Okay.
There's a workshop on food prep and by Cheryl Pradia, and exercise by Karen Eggert, who's with Wellness, HCA Wellness. And then there's a third section on cardiovascular health in athletes. And so this is the breakout session. So attendees and those of you who haven't had the opportunity to go online and register, I welcome you to our website, which is wellnesshouston.com. Wellnesshouston.com. You can go online and register online, and you'll have the opportunity to choose from one of these 3 workshops during the lunch session. The other way you can register is 713-599-1144. That's 713-599-1144. So you can go on and register either through the office on the phone or online. And then the afternoon session, Dr. T. Colin Campbell will give a discussion on what we should eat, the importance of what we should eat and what we should avoid. Dr. Esselstyn will talk about his experience in terms of reversing heart disease with a plant-based diet. And then I'll talk about the nutritional boot camp experience. And there's Dr. Charlie Noble, who's from Columbus, Ohio, will talk about the cardiovascular physiological benefits of exercise. And then there'll be a second open forum at the end of this session. This will be followed by Dick Gregory's discussion, and what we're going to ask him to do is kind of break it down to the audience in the way that he can do in using his stand-up comedian skills and the like. Okay.
Now you've assembled some very prominent experts, medical experts. What criteria did you use to select these individuals?
Well, I wanted people who were established in their fields, who had written about the subject. I wanted a slight, diversity of opinion, but I wanted individuals who were well-known, who could draw the audience, but individuals who had, written and studied and had, a considerable, scientific background. And I also wanted individuals who had experience in presenting information to the general public. All of these individuals have, in some form or fashion, through books they've written or interviews, have, expressed their, ideas and information to the general public. Because this was important, because we wanted the experts to be able to talk to the general public. And that's what we've assembled.
Okay. Are we ready for Dr. Esselstyn? Okay. We're joined on the program by one of the distinguished doctors who will be speaking this Saturday. Let me welcome to the program Dr. Esselstyn, author of Prevent and Reverse Heart Disease. Dr. Esselstyn trained as a surgeon at the Cleveland Clinic and at St. George's Hospital in London. He has been associated with the Cleveland Clinic since 1968 and was head of its section of thyroid and parathyroid surgery. His scientific publications number over 150. He has been cited as one of the best doctors in America in 1994-95 by Woodward and Weitz. In April 2005, he was the recipient of the Benjamin Spock Award for Compassion in America. In 2009, received the Distinguished Alumnus Award from the Cleveland Clinic Alumni Association. And to top it all off, he was a gold medalist at the Olympic Games in 1956 as part of the U.S. rowing team. Good evening, Dr. Esselstyn, and welcome to Vegan World Radio Show.
Thank you, Dr. Anteneh. We're pleased to be with you.
We're really thrilled to have you tonight. I've been reading your book, and I'm fascinated with your theories. We know that heart disease is the number one killer in the United States. Approximately 500,000 people die of heart disease a year, 3 million silent heart attacks a year. In your writing and your speeches, you have stated that dying of heart disease is basically unnecessary and avoidable if certain steps are taken. Tell us why you take this very interesting position.
Well, I would just say at the outset that if the truth be known, heart disease, which is the leading killer of men and women in the United States, is nothing more than a toothless paper tiger that need never, ever exist. And if it does exist, it need never, ever progress. And I think to to give some background to that statement, I think it's important first to look at, if you look globally, you will find even today that there are cultures where if you were a cardiac surgeon, you better plan on selling pencils. There's no heart disease in the rural Chinese, in the Papua Highlands in New Guinea, in Central Africa, and in the Tarahumara Indians in northern Mexico. And the common denominator there is that they really all have plant-based nutrition, and that was the sort of the shall we say, hardly rocket science, but it seemed like it would be very logical to take some patients who were very seriously ill with coronary artery heart disease and see if we couldn't have them really convert to this type of plant-based nutrition. And that's what I started back as a study in 1985. And what has happened is that over the years, they not only did they rapidly begin to lose weight and lose chest pain and lose their angina, their cholesterol has plummeted, their weight plummeted, their glucose, if it's all elevated, usually will plummet as well. And then we began to see some rather spectacular and striking changes in their angiograms. They actually began to experience a reversal of their disease, but most importantly of all, in a number of those, especially those who were told by their expert cardiologist that they would not live out the year, they've all now, all of your compliant ones have now lived beyond 23 years. We've had two that were unable to continue because of individual circumstances, this type of eating. There were also two others who had non-cardiac deaths. But it's really quite evident that you can not only halt this disease, but if you really get patients to understand the details, you can reverse it.
Now, can you briefly tell us about the science behind this reversal?
Yeah. I think it's important that everybody at the outset, the most important information that I can share with the patients that we counsel is that they have to know that they have within themselves this absolutely wonderful magic carpet of endothelial cells. These are cells that are one layer thick, and they line all of our blood vessels. And the endothelial cells, let's say when you're 14 years of age, if you were to spread them out one layer thick, you could cover perhaps 6 or possibly 8 tennis courts. And if you brought them all together, you'd have something as large as your liver. In other words, they comprise the largest endocrine organ in the body. And up until about 1980, we used to think of these endothelial cells as just sort of cute little bricks that were lining these marvelous vascular pipes that we have. But a great deal has been learned since 1980. And one of the most important was that the endothelial cell is producing this absolutely magical molecule of gas that we call nitric oxide. And that was discovered by 3 individuals in 1988, Dr. Furchtgott, Dr. Murad, and Dr. Louis Gnarl, for which they were awarded the Nobel Prize in 1998. But there are basically 4 functions that this magical molecule performs. Nitric oxide keeps our blood flowing smoothly through our blood vessels. It is the strongest vasodilator in the body. That is to say, when you run upstairs, the arteries to your heart, the arteries to your legs widen, dilate, carry more blood, and that's in response to the outpouring of nitric oxide by these endothelial cells. They also inhibit plaque formation, and they can destroy and keep in check any inflammation in the wall of the artery. And for example, you almost never hear of any teenager who's having a heart attack because they have this huge acreage, as it were, of endothelial cells, which are making enormous quantities of nitric oxide. However, where the roof begins to tumble and this house of cards begins to fall is because of the Western diet that we have. It's now become increasingly evident, literally, with every mouthful and bite of the common processed oils, olive oil, corn oil, soybean oil, palm oil, etc., dairy and meat, and all animal protein, chicken, fish, that we absolutely we injure, we damage, and destroy our endothelial cells' ability to make nitric oxide. So whereas you might have had a very high level of nitric oxide as a teenager and able to protect yourself, but increasingly that protection is lost as you destroy this endothelial carpet through this type of diet that we eat. This is so evident that in the Korean and Vietnam conflicts, at average age 20, literally practically 80% of our 20-year-olds at autopsy had gross evidence of coronary artery disease at that age. And if one felt that, gee, it's due to the stress of military, well, then let's look at a more modern study of those who have died between the ages of 16 and 34 from accidents, homicides, and suicides. And again, if you look at their arteries, coronary artery disease is now ubiquitous. Now, obviously, not enough yet at that age to kill them, but it's already there. It's interesting that when you progressively, therefore, continue to destroy your endothelial cell system, that early coronary disease that you have in your 20s and 30s really becomes able to manifest itself from clinical events such as heart attacks and strokes at your 40s, 50s, and 60s, and on up and so forth. And it's really quite powerful that this marvelous protection that we have of the endothelial cell and its product of nitric oxide is literally systematically destroyed. And I think the good news in all of this is that the reason that perhaps we're able to succeed and others fail, while I'm not quite as mean as I look, I can be a rascal as a taskmaster. And the reason that I'm seeing these patients with coronary disease is because their endothelial package has been so sufficiently diminished that they've already had this, that they've been struck down by this disease. And what we have pretty well, I think, shown in a number of ways is that when you can give a patient the time and the full benefit of an explanation of why it is they have this disease, I try to make them think that the health of their endothelial cell is like a seesaw or a teeter-totter that you see sometimes in children's playgrounds. And the way that their teeter-totter has been tipped all their lives until they're now here, let's say they're 60 years of age, the teeter-totter has been tipped in a downward direction, and all that they've been doing every day has been destroying and destroying and destroying their endothelial cells and the lining of their artery. Now what we do is we completely turn that teeter-totter the other way. In other words, we are able, when they stop having a single item pass their lips that is in any way going to damage any further their endothelial cell, when that ceases, the endothelial cells have the capacity to come back. And it's really quite striking when we're able to suddenly see patients, often within 10, 14 to 21 days, have their angina markedly diminished or disappear. And it's not because we've really yet washed out all of the plaque, but it's because there has been a profound restoration of the capacity of their endothelial cells to make enough nitric oxide so that they once again can dilate even that diseased artery. And if you recall in physics, Poiseuille's law of flow through the hollow viscus is related to the fourth power of the radius. It means that for a tiny increment in diameter of all those vessels going to the heart, we get a huge increase in flow, and thus their pain diminishes, and now they're really hooked. They've got it. They believe it, and we're off and running.
Dr. Esselstyn, I like your comment. This is Baxter Montgomery. Hello again. I think we've had a few conversations over the past few months.
Well, nice. I didn't know you were on board. How great.
Yeah, I was a fly on the wall, but I had to come out and share a few words. Thank you very much for staying up late with us and also participating this Saturday. Let me ask you...
Well, if I fall asleep, you just yell in the phone and wake me up.
We'll do.
That's okay. Let me ask you, in your years of treating patients with a plant-based diet, what do you think is the most powerful effect? Is it the absolute removal of the bad foods, or is it the addition of extra good foods?
Well, I think the first thing you do is, most importantly, you've got to stop the injury. But the rate of recovery, I think you can modify depending upon the foods that you give. For instance, I think it's absolutely essential that you have people understand that they must, when they're shopping, read ingredients. I don't want to have them buy any bread that's got a trace of any kind of oil in it. No cracker that's got a trace of any kind of oil in it. No spread, no canned good, nothing in a box that's got oil in it, because that's every food manufacturer seems to want to put oil in everything, and so the learning curve is pretty tough there. In that first 3 weeks, they're going to say, "My gosh, Dr. Esselstyn, isn't there anything that you can let us have?" And of course, you really do learn where the Ezekiel products are and where the shelves are that contain them, and you'll find the stores and you'll find the products, and then it begins to get so much easier. But attention to detail is the absolute essence of this, and this is why what you will commonly hear from physicians is something like, "Well, I don't know how you do this, because my patients just would never do this." Well, I am going to have to say that I quite respectfully totally disagree, because when you are willing to take, and we'll take maybe four or five couples at a time, and our counseling session takes 5 hours. This is especially an intense program that I devised because so many of our patients were from out of state, and they just can't come to Cleveland and then hang out for a week or so. We'll do the whole thing in one day, and then we'll have the follow-ups through email and through the telephone as necessary. But with this type of intense presentation, they can get it. But ordinarily, when you're in a physician's office and he says in 30 seconds, "Listen, I want you to stop smoking, exercise, and change your diet," and then they say that patients won't do it. What?
They're not giving enough information.
No. Well, what you have to have is when somebody now comes to somebody's office and then they get sent to see us, what is the one thing in their entire history of having this disease that is the longest and most intense, and that they remember? It's the fact that they understand now that the causation of their disease was not lack of taking a statin. It wasn't lack of getting a stent. It wasn't lack of getting a bypass. It was due to the food that they were eating and that they destroyed themselves. This is a food-borne illness. And
that's exactly right, and I think that's been my experience as well, and I hope that's a message we can get across to our listeners, not only tonight but over the radio. What you talk about the whole concept of a food-borne illness. If I were to ask you about the top chronic illnesses that we have, and I know you wrote a book on heart disease, but you have expertise in other areas. What are your thoughts on cancer, type 2 diabetes, and obesity, and other chronic illnesses?
Well, I will answer that, but I feel I should finish answering first your your earlier question.
Sorry,
We said we stopped putting in the foods that are pouring gasoline on the fire. Now, we want to put water on the fire. And if you just think in your mind's eye of the area of the blood vessel that has the plaque and has all that inflammation, and the patients, I get to try to have them think of that like a low-grade brush fire. Mm-hmm. Okay, now we're going to put this fire out. Well, how do we put it out? Well, the best way to put it out is with food. Well, what food? Well, you're probably not going to be able to do it, although we do let patients, we encourage them to have whole grains for their cereal, bread, and pasta, beans and legumes, lentils, vegetables, green and yellow and red, and fruit. But of all that group, there's only one that really has thousands of bioflavonoids, phytonutrients, and most importantly, naturally contains antioxidants, which are going to put out the fire, and that's the green leafy vegetables. Now, I don't mean just anybody's going to say, well, Dr. Esselstyn, you'd be proud of me. I have spinach, a little bit of spinach at supper. Well, I say that's fine, but I'm really not very proud of you yet, because if you think of a shower spigot and you're having a little bit of spinach at supper time, that means that of those 50 holes in that shower head, I've got one of them that's got a few drops of water coming out to put out the fire, and that's the spinach you've had. I have what I call a run-in period when I first start, and I want at least 3, maybe 4 times a day. I want green leafy vegetables, different ones. I want bok choy, Swiss chard, kale, collards, collard greens, beet greens, mustard greens, turnip greens, Napa cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, and arugula. And I want it. I don't want the same ones every night. I want some variety in there, because the antioxidants that are contained in Swiss chard may not be there in collards, and vice versa for kale and so forth. And they're just this tremendous salutary benefit. And so that's just really what hastens the recovery, because you think of it as the blood that is roaring over this area of inflammation is bathing, B-A-T-H, is bathing the area of inflammation. I hope that kind of helps to answer your question.
Okay.
On that one, then I forgot the most recent one.
I think the most recent one was...
the other diseases.
The other diseases. Would the answer be the same for the other diseases in terms of them being based on food as opposed to lack of surgeries and medicine?
Well, I think that's... Let's just take, for example, if I have a patient who weighs 250 pounds and they've had a heart attack, but after 5 hours of counseling, by golly, they really get it. And suddenly, 6 or 7, 8 months later, they don't weigh 250 anymore. They now weigh 175, 180, 185, but they're no longer obese. They've lost their hypertension. They've lost their diabetes. And their risks for gallstones is diminished. For diverticulitis is diminished. For osteoporosis is diminished. For Alzheimer's and dementia is diminished. For erectile dysfunction, for frailty. For lupus and rheumatoid arthritis and MS and the common Western cancers of breast, prostate, colon, endometrial, ovarian, pancreatic. And so it's really, when you start eating to save your heart, this is America's seismic revolution in health that is going to occur. It's never going to occur from a pill. It's never going to occur from changing insurance forms or electronic records. It's never going to come from inventing new procedures. The only way we're going to have a seismic revolution in health is to convince and show the public the lifestyle by which they just can totally eliminate these common chronic killing diseases.
You know, a few months ago, I told my uncle, who's a diabetic who lived in California, to get Dr. Neil Bernard's book, Reversing Diabetes. And since following that diet that's in the book, he's lost over 20 pounds, and his sugar levels have gone back to normal, and his blood pressure has decreased. So what you're saying makes a lot of sense, Dr. Esselstyn. Now, before we continue, for people just joining us, this is Vegan World Radio Show on 91 KPFT Houston, 89.5 in Galveston, and online streaming at kpft.org. My name is Dr. Anteneh Roba, and I'm joined tonight by Houston cardiologist Dr. Baxter Montgomery, organizer of this weekend's astonishing town hall meeting, The Declining State of Health in the U.S. And on the phone with us also is Dr. Caldwell Esselstyn, who will be a distinguished speaker of the event this Saturday, October 17th. We would like to take some phone calls in a few minutes about the advantages of plant-based eating. So please give us a call at 713-526-KPFT. But before we continue our discussion, let us hear from Dick Gregory.
Animals are my friends, and I don't treat my friends WTF. Next up is vegan.
Look, I have 10 children. If you heard on the news today that my 10 children attacked me, without even knowing what happened, you would say, what did he do to make his children attack him, right? That's normal, right? So, if you had a heart attack today, would you say, what did you do to make your heart attack you? That heart went with you all your life. That should be your friend. Your heart didn't jump out and attack her. It attacked you. Huh? Say, she gonna drink that beer one more time, and we're gonna get it tonight. And you be running to the doctor instead of apologizing to your heart. Say, I'm not gonna do it no more. I'm not gonna do it no more. Because the doctor fixing to have one too. Somebody asked me the other day, you've been fasting for 40 years. What does your doctor think? My doctor's been dead 37 years.
Okay, Dr. Esselstyn, one quick question. Now, with all this research that you've done, and Dr. Campbell has done, and many others, and with Dr. Montgomery's experience, why is this information not widely available? Why is it that only seems like very few people know about it? Because when the hospital I work at, patients have no clue about what to eat and how to take care of their diabetes or blood pressure and heart problems.
I think, again, this is a little bit more complex than we make it out to be often. It's really quite profound, and I think that going back, let's say now, close to 20 years when we were first getting our results showing that we could reverse heart disease, when I started this, I mean, I'd had a pretty solid reputation as a surgeon, but then people behind my back began calling me Dr. Sprouts, and which I actually kind of enjoyed, because I knew that we were getting something done that was really very exciting, and so I didn't really I didn't mind that. But once you have shown this, there is potentially quite a bit of profound upheaval that can occur. For instance, let's just say that what are the forces that might be working against us? Well, let's say that there are only really three: the government, industry, and my own profession. Let's talk about the government for a minute. Right now, you have a government that makes a food triangle, or I guess the USDA sometimes refers to it as a food pyramid. And they attract a group of nutritionists that they select, and they make up that food pyramid every 5 years, and it always still contains the very foods that literally will guarantee that millions of Americans will perish if they eat those foods. Having the USDA make up your food pyramid or triangle is like having Al Capone do your taxes. So you have to remember that every officer in the USDA was previously a office holder for the pork board, the egg board, the pork board, the Cattlemen's Association, and the dairy board. And really the basic function of the USDA is to support and maintain the agribusiness. Now, industry. Let's suppose that you happen to be a drug company that manufactures a statin. Well, at the present time, it's my understanding that the profits from statin sales are $21 billion a year. And the profits from those that make stents is billions a year. And for the medical profession itself, 10% of the Medicare budget is spent on stents. I just can't see these stent makers who are very anxiously looking forward to resolution of this epidemic. And, of course, when it comes to physicians, some physicians who are both doing surgery or doing stents are literally making millions of dollars, and I don't believe that they are clamoring for fewer and fewer and fewer patients. So that's sort of one side of the wrinkle. And the other side is just the fact that presently the whole insurance scheme is totally upside down. For instance, you are handsomely rewarded if you will perform a stent or a bypass, but these are only really necessary if the patient's in the middle of a heart attack. There's no question that they can be absolutely life-saving under those circumstances. But as far as doing it electively, there's not really a shred of hard data that seems to show that you see the elephant in the room when you talk about those procedures on an elective basis, which is when 90% of them are done, are that there is no lengthening of life and there's no prevention of future heart attacks. And the sad thing is with bypasses that when you put on a vein, you're literally putting on a time bomb. That's what the cardiologists often will say when they do an angiogram on somebody and they see a 90% narrowing, and they'll say, you're a walking time bomb. Well, wait a minute. We do make these time bombs when we put on these saphenous veins because we don't know whether they're going to last 6 weeks, 6 months, 5 years, or 10 years. And when they do go down, of course, then often there can be another cardiac event. But insurance is rewarding these technological procedures, but it does, and they don't treat the disease. But there is very little insurance yet solidly in place to take care of those who are willing to counsel patients in lifestyle that will, literally within weeks, will halt this disease and begin to reverse it. And so the patients really have to sort of scramble to sort of pay out of pocket for that kind of advice.
Right.
But I think that is Dr. Ornish has been trying and others to see if we can't make that turnaround.
Okay, thank you. Okay, let's see if we can take some phone calls. I think we have a phone call. Bobby's on the line. Hi, Bobby.
Hello.
Yeah. You have a question?
Well, yeah, I have two friends. One has had stents in his head for strokes, which may not be what he's talking about, but it might have a similar, it might be a similar case. I have another friend who is married to a doctor. They're both from Mexico. They're citizens, but the thing is they eat a Mexican diet, essentially, a very good diet. She's an excellent cook, and she's a doctor, but she has the idea that the Mexican diet is healthy, and I don't think so. And I'm thinking that these two people could benefit, and I don't know how to. One of them, the one who has had the stents, has been eating a vegan diet on advice from his doctor. He's actually lost weight and got healthier. The other guy could benefit from that, but I'm not sure that that his wife, the doctor, is going to go for it.
Okay.
How can we deal with these things?
I'm not sure I heard the question.
What is your question? To just give us a short.
My question is how I can benefit too. I'm thinking that these people, my friends and me and myself, who has a very poor diet sometimes, and I try my best, but, it's hard in America to eat a good diet. How can we convince ourselves to go for what he's saying and the veganism and the non-stent and the non-reactive medical? I'm thinking that single-payer health care where you have a choice, where it's not an elective, where you're not told what you can't do, but a preventative.
The quick answer is that you probably should seek help in a local healthcare institution that would support you. At the HCA Wellness Institution, we have such a support group where we help individuals transform their lifestyles, and you can either come to the conference and learn more about that, or there's a number you can call, 713-599-1144. That's 713-599-1144, and they can give you some direction.
Okay. Now, I think that'll help. I'm going to look into it. I'm going to try to tell my friends about it. These are good folks, and they're just kind of, I think we're all misguided. I think we've all missed the boat here, and this alternative, what we call alternative, should be the norm.
We agree. I think it's a good point.
Okay. Next, Hazel is on the line. Hazel, hi. This is Anteneh Roba. You're on Vegan World Radio. What's your question?
My question is the confusion over olive oil being bad. I just keep hearing that this is a good thing, and now I'm hearing it's not a good thing.
Dr. Esselstyn?
Yeah.
Can you...
No, that's absolutely correct. I think most of the popular press about olive oil is just that. It's popular.
I'm sorry. I was listening
or
to
maybe
the show.
About something about the Mediterranean diet. But when you really get into the science of it and you look at the studies, they're clearly, when you just isolate it, the only factor that you give even experimental young volunteer subjects and you analyze their endothelial reaction and capacity to make nitric oxide after they ingest olive oil, it is their endothelial cells are sufficiently injured that they cannot make the nitric oxide. And that's been repeated on numerous occasions in different countries by different investigators. It's solid research.
Okay.
Yes.
And I concur with that. I think the processing of the olive oil has a lot to do with that. And also when we talk about using olive oil in our diet, and any oil for that matter, first of all, the oil, to get to the oil state, is processed. Oftentimes, even though it's labeled first cold press or virgin olive oil, it's heated to some degree, and sometimes chemical solvents are added. So the oil is processed, and so it becomes rancid even before you use it. And oftentimes, when we use these oils in our diet, we are sautéing with them in the light. So you're putting a rancid oil in your system, oftentimes just by the nature of using the oil itself. And so that probably contributes to that.
A general rule is to try to eat foods as grown. And if you go out into an orchard of olives and you tell me that you can see a bottle of olive oil growing on a tree, I would probably say that was okay. But you can have the olive, but not the olive oil.
I agree. That's right. I actually advise my patients the best way to have lunch is to go in the garden in their backyard and get on all fours and crawl and graze. And you can't get it any better than that.
Okay. One quick question I have for you. In your book, Prevent and Reverse Heart Disease, you said moderation kills.
Yeah, that's right.
What do you mean by that?
Well, just what I think that says that that so many people or physicians are in the habit of using the word moderation. It has a sort of a noble, non-judgmental, soothing, sort of wiser than all connotation to it, and where if I, for instance, if I encounter a certain physician at a meeting and he says, "Well, how's it going?" and I say, "Well, it's going fine," and he said, "Well, I've heard about your diet, but I think you're pretty extreme or strict or severe." He said, "I believe in moderation," and I'll say, "Well, fine. Can you show me any study where if you have steak, which is going to kill your endothelial cells, you have it 3 times a week instead of 7 days a week? That, in other words, what you're doing is it's like a question of whether you want to be shot or hung." and so it really there's absolutely no point in ingesting in moderate amounts the foods that are going to continue to kill your endothelium.
Moderation is more torture, don't you think? I mean, it blunts your results, and it only enhances your cravings. If you eat steak once a week, you're only reminding yourself the other 6 days that you want it.
Or you get your erectile dysfunction at 70 instead of at 60.
Yeah, that's right.
Now, you have in your book, you mentioned certain rules, foods to avoid. You said anything with a face or a mother.
Yeah.
Dairy products, oils, refined grains, and nuts. Now, the nuts, are they for healthy?
I'm a little bit tough on nuts, and I'll tell you why. What are nuts to contain? They contain saturated fat. And what does saturated fat do to your arteries? Yeah, it's not good.
Right.
And so as long as I've got a winner where we can actually arrest and reverse disease, why would I want to ever add again the product? And here's what happens with nuts. When I was growing up, we had nuts twice a year, Thanksgiving and at Christmas. And when you wanted them, you had to have this machine, a little gadget in your hand, a nutcracker, and you had to crack these nuts out of their shells. And after you'd done that for about 10, 15 minutes, and maybe you'd broken a nail or two, you'd had enough. Nowadays, if I ever said you could have nuts, there would be nuts in the glove compartment, there would be nuts in the workbench, nuts in the bathroom and in the kitchen and the dining room, and I've seen people where they got the word somehow that nuts were good, and their cholesterol starts climbing up, and their weight starts climbing up. Nuts are a very highly addicting situation, and that's something that I don't want, and the same thing is in the avocado. So as long as the patient has symptomatic heart disease, they've had clinical events, there's no nuts and avocado on my program.
But if
somebody does not
healthy,
have heart disease,
then they can't eat nuts.
Well, no. Well, no, wait. Let's talk about this a minute.
Okay.
If they don't have any heart disease, and they want to have nuts and avocado, that's fine, providing that they can tell me that without a statin drug, eating nuts and avocado and the rest of their plant-based nutrition, that they can keep their total cholesterol under 150 and their LDL under 85. Okay?
Yeah, that becomes difficult. And the other thing with nuts, too, is that we have a hard time. I mean, the scenario you painted with getting nuts and having to crack them yourselves, they probably were nuts grown in your backyard or someplace. But, many of the nuts we get commercially grown, and many of them are pasteurized. They're having to steam them and the like. And so,
well, they've also got oil on them, and they've also somehow been fried.
That's right. They haven't been heated, so they're rancid fats. And so I think that's the other problem. I don't think there are a lot of good sources of good nuts.
And also, most of the literature that you will find anywhere that is scientific about nuts, guess who's funding it? The California Walnut Commission or planters.
Yeah, I understand. I agree with the nuts. Getting avocados, getting organic avocados that are minimally processed, I think, is easier to do than nuts. And we've been able to successfully separate the nuts and have people consume organic avocados that are not processed, and they've done reasonably well. But I agree with you with the fats. I think it's a problem if it's done excessively.
Okay, well, we're coming close to closing time.
No, we're just getting warmed up.
That's right. Yeah, really.
It's a warm-up for Saturday, yeah?
If people still have questions, unfortunately we can't take any calls, but if people still have questions, they could forward their questions to me or Dr. Esselstyn or Dr. Montgomery by writing to info@veganworldradio.org, and we can forward it to them. But Dr. Esselstyn, you can also give us your contact numbers and website if you have it.
Yeah, at the website is heartattackproof.com.
Okay.
And the phone number at the office is 216-297-8556. That's at the Wellness Center. Yeah.
Okay, thank you so much for coming on this.
Well, I thank you for the kind invitation. It's been fun, and I look forward to being with you on, I guess it's Friday night and Saturday.
Yes, sir. Look forward to meeting you.
Thank you. We can't wait to meet you, sir.
Bye-bye.
Bye.
Bye.
Thank you, Dr. Montgomery, for being on our show, too. Do you have any closing comments?
Yes, well, thank you very much. Yeah, we, in essence, we want to, again, get the word out that in this day and time where healthcare reform is being vigorously debated, the primary approach should be to reform our health, and that's the message we want to get out in our conference this Saturday. It's from 7:30 registration in the morning till 5. You can go in the morning session, afternoon session. The website again is wellnesshouston.com, wellnesshouston.com, or you can call my office at 713-599-1144, 713-599-1144.
Okay, this concludes our discussion portion of the our evening. Now for some local announcements. Tomorrow, Thursday, October 15th, grassroots organizing for the Animals with Heart. Please come to the reorganization meeting for the Houston Animal Rights Team at 7 p.m. There has been an important update. The location has recently changed for tomorrow only. The Heart meeting place has been changed to the 11th Street Cafe in the Heights, located at 748 East 11th Street at Studwood. Please come out to learn what you can do to raise awareness for animals at a grassroots level. Everyone is welcome. Newcomers are encouraged. Join the discussion of ideas for leafletting. The newcomers are encouraged. Thanksgiving Day Parade and the annual observance of Free Friday also. Please call 832-380-HEART or visit www.houstonanimalrights.com. October 14th and 22nd, social gathering for plant-based eating. The Raw Vegan Potluck group will gather for an extraordinary lecture October 22nd with book authors Victoria and Sergei Butenko at Taft Street Coffee House. Please call Tambra at 281-530-6736, cell 713-515-7304 for details. October 16th and 17th, Conference for the Animals. Texas Human Legislation Network Conference in Austin. October 16th and 17th. Call 888-548-6263 for details. October 17th, what we've been discussing tonight, Secrets of Nutritional Healing workshop featuring Dr. Baxter Montgomery, Dr. Neil Bernard, Dr. Colin Campbell, Ph.D., Dr. Caldwell Esselstyn, and Rick Gregory. For more information, please call 713-599-1144. Remember that if you have missed any portion of tonight's Vegan World Radio, you can listen again by clicking on the archives link at kpft.org. I'd like to thank Shirley, Evan, Christopher, Alma, and our new intern, Natisha, for all, I don't know if I'm pronouncing it right, for all their help with this evening's show. Also, we greatly appreciate our dedicated listeners who follow the show. We know that this is a late hour and that many of you listen the next day via the KPFT archives and through the podcast. We will be going into the fund drive in a couple of weeks, so if you like what you hear on Vegan World Radio, please consider sending in an early pledge gift to support the show and allow us to thank you on the air live. Consider sending a tax-deductible donation written out to KPFTs and send it to Vegan World Radio at KPFT 419 Lovett Boulevard, Houston, Texas 77006. And please share any brief comments you may wish to have announced on the pledge show with our thanks. Please stay tuned for Damage Control coming up next. And remember to tune in again next Wednesday at 10 p.m. to hear a return visit from our beloved Shirley Wilkes Johnson, who will give us the latest news about the annual statewide vegan chili cook-off coming up next month in Austin and much more. Thank you for listening, and we welcome your comments by writing info@veganworldradio.org, as well as Twitter and Facebook. Good night.
Celebrate the International Day of Climate Change Action with friends from 4:15 p.m. to 8 p.m. on Saturday, October 24th in the Woodlands. Bring an organic or local potluck dish to share. Enjoy music, children's childcare and activities, educational presentations, and an inspirational movie, Renewal, about how people of faith are standing up for the environment. Sponsored by Northwoods Green. the Sustainability Committee of Northwoods Unitarian Universalist Church. Donations accepted, but not required. For more information, go to 350.org. KPFT, Houston.